Nice to see you, and good to see you in person again. Kia ora.
Nā.
Kia ora tēnā tātou, ko nā rai haine tōku ingoa. E mihi atu nei kia koutou katoa I tēnei wā. Kia ora.
Andy?
Hi, Andy Cranston here. I know Nikki from we were on Sport Gisborne together a while back, and known her from other areas. So good to see you again, Nikki. A little bit, little image there. Yeah, so Andy Cranston, councillor and board member.
Kia ora, Andy. And I take it that you know Ariana and Fraser.
Mm.
So I'll hand that ako kōrero over to you guys in the boardroom.
Thank you. I'll hand it over to you, Nikki, and your team.
Okay, thank you for everybody. Just wanted to introduce Letitia, Linda Key and Claire Johansson, who are supporting me at the moment. I'll probably hear my voice the most, and I do talk quickly because I know I've got a bit of a time frame, but appreciate the time to do this. As you know, we provide service reports to you on a monthly basis. And I came to the conclusion that it only gives a very small snapshot of what we do and how we do it. So I suggested to Jim that we actually have a little bit of a presentation on understanding the whole way we work and the work that we do and the mahi we kind of do it, how we do it. And then that will make it easier when you get those reports to kind of see the context of that. So I present it with pride, mainly because I've kind of started each slide with workforce issues in the particular areas of the directorate that I manage and lead, but I also want you to have hope because I'm very inspired by the people that I work with who work in a way that makes sure that people get what they need as much as possible in this pandemic time, workforce shortages. So I hope you feel inspired, probably a little bit alongside supportive of our workforce crisis, but inspired by the way we continue to work with our whānau. We ready? So we're going to share the screen. As I said, I'm going to talk at you a little bit for a while, if you could bear with me and just listen, and then we'll hopefully have some time for some questions.
Yes, Kate Pai, Nikki, and just a heads up, everybody, we are now streaming live on YouTube. So if anyone's out there watching, no mai hara mai, welcome. Over to you, Nikki.
Okay, so you're right, Claire?
Yep, sorry.
Our first slide is going to be around describing the services that, obviously our purpose in Tairāwhiti, under Manaaki Tairāwhiti way of working, is enabling whānau to flourish, and obviously improving equity is what we strive every day in our work.
You may have slipped onto mute, Nikki.
The boardroom is frozen.
Yeah, I was just about to say that. I feel like the boardroom's frozen. What we can do is, in the meantime, I'm not hosting this, so I actually can't exit out of her full screen.
I'll just text Jim to let him know that they're frozen.
Okay, thank you, Kim. Because there are some things that we can still do. Actually, when Nikki comes back, it would be great for us to kind of listen to her kōrero while also looking at her, even though it's just a one pager, but on page 15, because then we'll be able to, I mean, we've got the team right there, right? You know, in order to be able to kind of flesh out our ideas and what we're thinking in regards to the report. So, but what I will do is I will actually take us to the beginning of our agenda and kind of get out of the way some of the more procedural things. So we have apologies from Sandra Faulkner today in terms of interest on 2.1. So our committee's member schedule of interest is there for review. If you do have anything to add or change, please make sure you email those things through to Rachel. Also, I'd like to ask if there's any conflicts in relation to today's agenda items. Doesn't seem like there are, because usually you'll email those things through to me prior. Right, I'll take us to the previous minutes, which are on page 6. Do we have any matters arising from our previous minutes, whānau? And if they are matters arising that need staff response, yeah, it'll. But we're lucky that we've still got Ariana here and Fraser here. I can see them moving their mouse around on their screen actually over that side. Any matters arising?
Was Te Rangi an apology, Josh?
I haven't heard from Te Rangi. I do know that Rongo Whakaata have just had the elections, so
yeah, just seen them come on, Josh.
Oh, okay, yeah, oh, great.
Hello.
Hey, Morena, Whananga. Morena.
No, I had trouble getting into the link. I couldn't find the link initially.
Oh,
I'm here now.
Yeah, you're here now, so that's great. We're just having a little bit of technical issues. The boardroom has gone out on that side. However, the screen that they were sharing with us is still being shared. So we're just kind of going through the procedural things at the moment until they come back online.
Kapai.
I think, Claire, are you sharing the screen?
Yeah, Claire is.
Maybe if you are, Claire, you could take it down until the boardroom comes back. No.
Yeah, I'm wondering if they can even hear us at all. She might have, yeah. Hopefully. I'll put something up in it. Yeah. All right, back to our minutes, whānau. Do we have any matters arising from our minutes? No matters arising. All right, I'll take us to page 10, which is in terms of our action items.
Okay.
And are we back?
Yeah. Can you see us?
Okay.
Yeah, you can see us now.
Yeah, we'll need the camera adjusted down to be able to see you. Probably, but we can hear you. We can continue on there.
Yeah, carry on. Yeah, we'll adjust the camera.
Okay, we'll readjust. So thank you for that. So basically, this is just a quick one-page outline of the services that that I lead with my clinical leads. It's certainly not, doesn't encompass all of it. The portfolio is much more complex within contracts within those particular services. But I think the main two things before we proceed is that what we do because we care and we do it with heart. So I want you to have that at the front end of the presentation. The Manaaki Tairāwhiti way of working, I presented to before. That is something that's reasonably well known within our community. It's iwi-led and there's some operational leads that I'm part of. I've been working with for the last 10 years. And this is something that Dallas and Haynes and I just put together conceptually to help people understand it. I can come back to that at another time, but I just wanted you to look, this is the way that we work. And there's some very good kind of directives and tools around how staff can, if they've got a problem, how they can solve it by looking at this way of working. It's actually integrated into our work. So I wanted to start with recruitment, and just to give you an idea of how we integrate the Manaaki way of working into our recruitment. So our adverts, we've started putting in what our Manaaki Tairāwhiti way of working is, trying to give people a different steer, particularly around the country when it's very competitive to get workforce, around that we work differently in Tairāwhiti. And that we're more concerned about how to support whānau, and we want to break down some of those system barriers and criteria. Our interview questions, we have got across the board from managers, staff and administrators. We send them the Manaaki Tairāwhiti way of working concept, and in the interview we ask them what this means to you. I'm not really interested in people coming to our service that can't relate to this, and The other questions we ask about, tell us about privilege in your life, what does whatever it takes mean to you, and how would you improve equity in the work that you're doing. So just give you a feel that starts right from the recruitment stage and then right through to how we deliver services. As Jim knows, for 10 years, at the minute I walked in and where I've come from before, clinical leadership and management partnership is absolutely vital in everything we do. We've just interviewed our new head of departments, SMOs, and I was just so inspired by their leadership and them wanting to improve equity in their interviews and the way that they want to take the services. I can't do with them, they can't get things done without me and the different levels in between, so that is a very essential part of how we work. Just to let you know, a cross-sector collaboration with a number of agencies. We actually talked in 2016 a shift in this approach. There is still too much focus on the organisation, criteria, system barriers. So we continue to kind of encourage people to work differently. But I was just flagging this slide because I thought actually it's 2016, that's a few years ago now. We need to kind of act on some of these things, and the operational leads hui and Manaaki Tairāwhiti governance are a way of helping that happen. So just a whistle stop through, and that's all it is today, whistle stop through the different services and showcasing some of the things that, where people work in this way. Our oral health services across the lifespan, from hapu mama to older adults. We work providing service for preschool, school-age children, but we also provide dental checks for people that are going to Waikato for cancer treatment and dialysis, etc. We also have referrals for GA for people with special needs and children that have, we've tried everything in the clinics, but they need to have some work under GA. Our approach in that is that, you know, the people around dress up, they go and make sure that the whānau are met with at home before they come. It's very personalised. So in theatre, the booking system, I'm not going to talk about people, but the system might wonder why someone hasn't turned up with their child for a GA 3 times. The system will want to discharge them, but actually we know who that person is and their whānau. We know why they didn't come. Well, because of transport or because of childcare or because of COVID, whatever. And we will continue to walk beside them until they get to what they need to happen. So there's quite a lot happening across that space. The school-based program, we used to have the luxury over many years of mobiles at schools and going consistently around the place. We're now working with 50% of our dental therapy workforce. And so we're actually going to be trying to recruit some part-time dentist hours so that we can fill some of those gaps. But we have to work differently. For children coming in with needing pain relief, we actually are not turning them away. We will see them, but we're making sure that we have a direct access to our principal dental officer to write a script to get antibiotics. Our kaiwhina will get them filled, the prescription filled, and drop off the prescription, the medication to the whānau. So just making sure that when you send a referral or where something happens, that you actually follow it through. Benita, who's the program manager, and I are presenting at the National Oral Health Conference later in the year, and that will be to try and, for a workforce drive, but also to present around the country how we work every day to improve equity for our tamariki and whānau. So the Well Child, which is the public health nurses, ear nurses and vision hearing. Well Child often gets confused with Well Child Tamariki Ora. Well Child is just a name for the public health nurses and other services. So we've had, basically the public health nurses and other nurses have been absolutely committed to vaccination and swabbing for 2 years solid. So some of the programs that you see outlined below have not really had justice in the last 2 years. What we're trying to do at the moment is regroup and look at what we need to do. Obviously, immunisation programs that run in schools and other places need to be carried out regardless, and the team can respond to that. But, you know, obviously we need to be doing our before school checks and all of those things, and sometimes those things fall off when we actually have a pandemic. The workforce, we are short of youth nurses at the moment, and that is a really critical area. We need to support our rangatahi to get what they need in schools particularly. So those are the kind of areas that, so every day it's about responding to the need in front of them. And I must say they've done a sterling job in the last 2 years to support the whole program of vaccination and swabbing. So just going on to women's health. As you know, we have a cycle screening program. Evelyn Cross is the lead of that. I always say to people that we must understand our history and the local context of what happened here. Women, you know, at some stage, you know, women were harmed, and we must make sure that it never happens again. So we have leadership and oversight of invitation and recall, the program and the register. The register is a dynamic program which has a surveillance component. So it's really important that we have people that can support practices and making sure no woman gets left behind. And we're just also looking at, so walking beside women to get to colposcopy appointments if they do have an abnormal smear. So obviously the Well Child public health nurses provide the HPV vaccination. That has a direct relation on later in life, people, or through their lives, people turning up for colposcopy. So we need to make sure that no one gets lifted up. We work closely with our iwi providers to make sure people get smears and that they get to their appointments. And we're also working with places like Huakaiti, where we've gone in as a program, there's only 2 people, to go in and clean up the data so that they don't have to worry about that stuff. We're there to support people. We also have a support role in gynecology to make sure that people get to their appointments, particularly Māori women, and that person will go out and pick people up if they need to. So we're doing whatever it takes to get people seen. So just moving on to our sexual and reproductive health service, and the manager there wanted me to emphasise sexual and reproductive health. It is not, they're not separated. We don't silo needs. So if you need a smear, if you come in for a smear, then you may be offered an STI check, talk about contraception. We do offer a termination clinic there. Our counselling, our midwives and nurses are trained counsellors, so they integrate counselling into their approach. If there is a mental health need or there is another need if the person appears, then they will be walked beside to get what they need. So it's not about coming in and the staff responding with a script. It's about coming in and saying, what do you need from me today? And sometimes people don't know what they need. So it's good to have people who have trained in that narrative and that counselling who can draw that out. It is a team approach, and the team put a lot of time into nurturing themselves to actually be able to provide this very sensitive service. We've been really lucky to, you know, a few years ago, we were lucky to have a mixed case review meeting with the ONGs. Now we have an ONG or 2 that actually work within the clinic to provide that support for termination and missed pregnancy. So, and also we have a visiting sexual health doctor who comes down once a week. So the transgender community are getting a better support because the team can now provide that specialist. It is a specialist area. So just letting you know that, yeah, it's not just sexual health, it's not just reproductive, it's integrated. Another example is a doctor ordered a blood test before a procedure at the hospital. That person lived up the coast. We organised them to come down the night before. The clinician went with them to get a blood test, get the results, drop them off at their caregiver so they could get to the procedure on time. So if that had just happened, what would have been labelled possibly is that person was uncompliant because they didn't get to their blood, their blood test prior to. So really important that we just make everything happen for people. The neonatal unit, we've struggled with staff. Probably our biggest pressure area will be in May, where 3 of our staff are going on parental leave, which is wonderful news, but actually puts the unit under a bit of pressure. We are basically, if our staffing doesn't improve, we will have to move the neonatal unit into the Planet Sunshine area, which we've already started to look at that. We would like to take babies a little bit, not sometimes Waikato want us to take babies earlier. We can't always do that because we have to keep working on our workforce and our skill mix. We've got head of department in neonatal unit for the first time. We've always had a clinical lead, but actually provides amazing leadership in that area, particularly when we're short, often in weekends, with not knowing whether, are we going to have births? Are we going to need the neonatal unit? So maternity and neonates have to work closely together. Most of our work, obviously, apart from looking after the babies, is with parents and whānau, and working with the well child providers like Tairāwhiti Health, Plunket, and child development and the outreach nurses to make sure that these mums and their whānau and their dads are ready to take their prem baby home. So that's supposed to be Planet Sunshine, but Planet Sunshine, which won't be called that for much longer, we will use the Māori name, but the children's ward, inpatient unit of 12 beds, an outpatient service. So we have a nurse coordinator role who is there not to do jobs for the doctors or sit in their appointments, but actually to improve equity, to get our missed appointment rate is quite high or has reduced a little bit. But their sole purpose in life is to make sure that our Māori children get to their appointments. And if we've got people coming from the coast, we want to make sure that they see their audiologist, their child development specialist, and other people in the same day or 2 days that they're here, not to expect them to come all over the hospital over a 3-week period. So that's really important. And we also have a play specialist, which is funded by the Ministry of Education. So our outreach community nurses, and obviously, we work closely with the GPs and paediatricians around this service. They are clinical nurse specialists. They respond to the needs in front of them, but one of the key roles that they have is prompt home assessment. So following, if a GP sees a child that they're not sure about, that they will respond and go and visit them at home. So they continue to still visit during our COVID times, and obviously have a big role to follow up babies born greater than 32 weeks. Our maternity, you probably heard a lot in the media around midwives shortages over New Zealand. It is no different here. There is some light at the end of the tunnel, hopefully later in the year when people come back from parental leave or overseas, but we're losing a lot of people overseas. Or people who want to reduce their hours, and then we can't quite get enough to fill the roster. We have employed some nurses to cover the postnatal area. Our antenatal clinics still exist with the obstetrician, and we want to make sure that every appointment is filled. We do not want pregnant women, hapu mama out there who are not able to get to their appointment. The LMCs are stretched, so they can't always do that. We did have an LMC shortage over Christmas, and we worked with primary care LMCs and our well child providers in Plunket to make sure that no woman kind of got left behind, and provided an amazing core midwife sort of LMC service from the unit, which was fantastic. And we're also one of the leaders in New Zealand around our maternity quality and safety program, which is cross-sector. Sorry, I'm nearly there. Child Development Service. This is a transdisciplinary team of different professional groups that work to support children with neurodevelopmental challenges. So it could include cerebral palsy, developmental delay, autism, ADHD. This is a very specialist service, and although we do have different disciplines like psychology, OT, physio, finding a professional workforce that have worked in this way is quite tricky. So we've been given some extra money from the ministry to improve our waitlist response. So we're trying to recruit. Transdisciplinary approach is really around people blurring the boundaries. So we have one therapist per whānau. So if in a normal situation, you might have an OT, physio, social worker, speech therapist all going in to see a family, that just is 10 more cars up the driveway. So we try and have one therapist per whānau who can actually cross the boundaries of those professional groups in a safe way. We've also started AWHI appointments, which is when we get referrals. The team leader will now ring all the whānau or email them about what support can be provided right now. So being present to their need and responding right now. And recently there was a before school check picked up this child who was the parents were having some challenges in their development, and obviously travelling in a car was really problematic. Child trying to jump out of car. that had not been picked up, but when the therapist rang them, she was able to order a car seat to help, keep that child safe in the car before they start any other assessment or treatment. So just being able to respond to that safety need really importantly early. I just wanted to read you some feedback from whānau who had an awhi appointment by phone or email. I was overwhelmed with happy tears and accept any support you can give. Thank you for connecting with me, taking time to listen, looking forward to future emails and steps forward for my tamariki. So it just shows you how that kind of support early on in the piece it makes a huge difference. We've just employed a whānau Wellbeing and Child Protection Program lead who starts in April. That was previously called a health broker. So over time, Te Pāhara Kiki had brokers, so we had a health broker as part of that. We also had a gateway assessment and coordinator who was based, paid by MSD, but was based in the public health team. We've actually merged all of these parts, components, and also our VPW, which is Maternal Wellbeing and Child Protection Forum. This person will also sit on the operational leads hui at Te Rito Hub within Manaaki Tairāwhiti. And underneath that, they have, there is a health broker support role who is also a kaiawhina for oral health. So that kind of serves two purposes. And the health broker support role, the person had recently been out to support someone that no other agency was able to engage with due to family harm issues. And just kept, whether it was a rat test, a food parcel, keeping on top of how they were during their pregnancy, was able to kind of get them safely to the hospital to have their baby just by having that persistent engagement. So I don't really care what they get in for, whether it's delivering a rat test or a food parcel. It might not be in their particular job description, but actually whatever it takes to get that engagement. Claire started with us, I think, last August. So how we do business. So although we love the heart and soul of what we do, we actually have to run a business. So this has been the biggest, I guess, help to me in the 10 years I've been here. As Jim knows, I've been lobbying for a long time and I'm really clear about what this role offers. I think there is obviously over time, we will actually see the real benefits of maximising revenue and reducing waste, which we often talk about, but it's quite hard to get that absolute, those measures. So really it's understanding every part of the business, making sure that the systems and processes work efficiently so we're not wasting time, and supporting the managers to do what they need to do. They're not business experts, but they've actually got someone to work beside them who can actually make things happen. So just in summary, obviously, this is the way we work. We've presented to a national conference about in child and youth epidemiology, which was very well received. And we have a slide that actually has got a door breaking down. So those system barriers, as Jim well knows, I'm often knocking on his door going, how has this happened? What are we going to do about this? So just simple things sometimes, but just create tremendous barriers. And it's in our internal, if our customer, we're customers of some of our internal services. So we want them, our internal services to work like this as well. Respond to us, be present so we can actually get what we need to do done. And this is a language as well. So my team are used to hearing me talk like this, responding, and collectivism and breaking down barriers. So that's me.
Awesome. Thank you very much there, Nikki. Really appreciate that. I did, obviously we'll have some questions, right, whānau? I did want to actually ask a question around, in your report, you talk about the audit of colposcopy and the numbers affecting the revenue stream. In what way are the numbers affecting the revenue stream?
Oh, sorry, Josh, I don't remember saying that.
Oh no, it's in the. Sorry, it's in the.
It's in the report.
It's in the report. I'm trying to marry up the stuff that you're presented, which is great. Yeah, which is absolutely great in terms of the actual delivery. But yeah, and also the focus on tightening up revenue stream as well in regards to Claire's role.
Yes.
in the report you kind of talk about both of those things and the connection there. Can you just expand on like what's meant by that connection?
How long have you got?
Got 30 seconds.
So it kind of just raises, you know, like Jim and I talk about this a lot. I guess you've got to work out what effort you put into what gain. It's around systems. So we have information systems, you know, we have our patient management system, we have a GynApp system, which is supposed to capture where the doctors actually and nurses write into. So we've got different systems, they spit out different numbers. So we're trying to reconcile that at the moment. That's the simple answer. And without that support, so at some stage, you know, it may affect our revenue if we don't get it right, but we just kind of need to persist because it starts at the front end. As soon as someone walks out of a clinic and doesn't fill out the right code, then it doesn't go in the system and then it doesn't generate information for an invoice. So it's just Claire's expertise is making sure that end-to-end process is really clear and that clinicians know why they have to write something on a piece of paper, which might end up getting paid for something.
Awesome. Hey, thank you very much for that explanation there. Nikki, we've got a couple of hands up. Go to Andy and then to Auntie Hickey.
Yeah, thanks very much for that, Nikki. Under barriers to employment, that's a reoccurring theme and we're all getting a handle on just how serious that is. Is housing availability a significant issue? By that, do I mean is there people not taking up positions because of it?
I have heard of that. I have heard of people leaving town, and I have heard of, I think what I say to people, Andy, is, you know, when my managers say to me, well, what's the point? There's no housing. And I mean, it's a glib comment, but it's kind of right, is that we have to do whatever it takes. I have suggested I move out of my own house for a while to actually engage people into the district until they get settled and find stuff. So I think we do, you know, between our staff and the people that we know collectively in our community, I think we all know of people who might have something for rent or something that might come up. So it does look daunting when people are overseas and trying to get in. But I think we just collectively need to work together to make sure that that does not become a barrier. Otherwise we will not bother.
Yeah, I agree with that. Thanks, Nikki.
Thanks, Andy. Auntie Hickey?
Kia ora, Nikki. Thanks for your presentation and congratulations with the appointment of your business performance analyst. We were very envious of you when that happened. However, my question relates to what strategy do you have for improving the immunisation rates while trying to cope with the challenges of COVID?
So there is a collective group to actually respond to the needs of immunisation. I think what happens with it often comes back to like cervical screening, and immunisation comes back to the Women, Child and Youth Directorate to manage. It's not, it's a collective across the community response. So our biggest thing at the moment is that we started this way before we had a group, but it was around well-child tamariki providers like Tairāwhiti Health, working alongside them. So the most hard to reach or haven't engaged with primary care, whānau and tamariki, we will go into the homes together to immunise. We still do that, and we're looking at ways in which we can do that. And just supporting primary care and whatever we can with giving them information and data to be able to do that. For cervical screening, for example, we give people colour-coded audits. So iwi providers and primary care know exactly who to give smears to. The same thing with immunisation, we need to provide that support. But Jim might want to talk on the wider collective response to immunisation.
Yes, even before the advent of COVID, we were really recognising that our efforts to try and get up higher rates of immunisation were hampered by the fact that the current predominant model of service delivery in the country, in Tairāwhiti in particular, around general practice-based vaccination does not work for all of our whānau. And so we were moving to, unfortunately got waylaid by COVID, but to actually set up an alternative system. And Ariana can talk to this as well because she's primarily involved in this, to run a parallel system, so that which is based around our iwi providers, now of course going to be greatly augmented by the by the vaccination assistants and their ability to contribute to this as well, to be able to offer a alternative methodology for those whānau who want to choose that, who would prefer that it be linked into their Wellchild Tamariki Order providers, so both Tūranga Health and Ngāti Hauora being the predominant Wellchild Tamariki Order providers in Tairāwhiti, to be the upfront place for vaccinations to be occurring, rather than currently where we've got both Nikki's outreach immunisation service and Tūranga Health in particular trying to catch up later on when the system hasn't worked for whānau. So that's the strategy. Ariana, I think that we are going to get back into that again now that we're sort of getting past the current wave and get back into those discussions. But she's turned her microphone on so we can talk.
Yeah, kia ora, Jim. So it's timely now that we actually look at immunisations across the board. So moving, taking COVID vaccinations with us and putting a focus as we're coming into influenza season, as well as the MMR schedules that we're going on, and a real focus down into our childhood immunisations. We're just in the moving from or taking COVID with us and moving into BAU, but actually planning through a whole immunisation approach.
And as Oz always says, let's not forget her hapa mama, pregnancy vaccinations, it's across the lifespan. So, and making sure, like Ariana, measles and pertussis and all those things don't get missed out. So it is I think we have a different response coming, and the pandemic, rightly or wrongly, has forced a different way of working as well.
Yeah, there's a lot of learnings that we can take already. I mean, with just in that vaccination space alone, some of the learnings already are around workforce capabilities and the skill sets that have been grown in non-regulated workforce and where we move with that. So yeah.
Thank you.
Kia ora, Auntie Hiki. Nā.
Kia ora. Can I just start by saying I love the presentation. I love using equity as a driver, and particularly the whānau lead componentry to this thing. Well done. Congratulations on those aspects. We're doing things differently and more specific to our population, which is fantastic. I wanted to, and this is probably not a question for Nikki, but more for Jim probably, was just around protecting these types of services as we move through the reform process and going into regionalisation. So this is obviously a program we want to enhance and keep for ourselves. But I'm just signalling here: are we able to keep these programs alive in the transformation process, rather than go into a whole of regional concept?
I think the short answer to that is yes, because and that is predicated around the fact that the health reforms have that very strong localities approach within them, and as you're aware, Toitū have already put together an approach for Tairāwhiti around localities that is we understand being favourably considered within the Māori Health Authority and within Health New Zealand as to be supportive, and it is exactly these sorts of localised work that is proving effective with whānau that needs to be encouraged going forward, and that's the reforms are designed to actually make that happen. So I think that that we're probably we've done a lot, as you know, we've done a lot of this work here, and we've had to run the gauntlet a little bit with the ministry. At times, we're just having a current little fracas with them around another area in mental health, where we're diverging from what their grand plan is. But I think that that's going to be much easier, particularly with Māori Health Authority, from what we're hearing from Rihanna Manuel's words and actions, and also iwi Māori partnership boards and the role that they're going to have going forward in the new health system. This type of work is clearly going to be something that will be favoured and made sure that it happens.
Excellent.
So thanks, Na. Couple of things that we're proactively doing. One is, at any conference opportunity I will present at. And ministry people actually came to our one in Wellington because they wanted to hear more about it. And I also am strengthening my relationships with all the ministry portfolio leads as well, because they do know that Tairāwhiti works differently. So, I mean, we just need to keep that up. I think all of us have a responsibility in the next few months to keep that on the radar. But I'd also like, iwi has led this kind of way of working, and I would like to see it more within the DHB. So I guess I'm here to say I keep putting it on the table. Hopefully it will morph into other areas. Yeah. I know Hiki's heard it before, so.
Kia ora.
Thanks for your feedback, everybody.
Awesome, thanks, Nikki. Kia atu, Rangi.
Nikki, yes, I just wanted to say thank you very much for the presentation. Very impressive. The thing that struck me most was, besides all the great work that is being done, was the problem-solving aspect. As we know in this space, Murphy's Law is quite prevalent. And if something is going to go wrong, it will go wrong. And just making sure that people make appointments and basic things like that is really impressive to see, because they just turn up as statistics otherwise. So well done to you and your team. Fantastic work, and keep it up. Kia ora.
Thank you, everyone. I feel very heartwarmed today, and we'll keep fighting.
Thank you very much there, Nikki. Kim, I saw your hand up before. Did you okay, that's a point. All right, thank you very much there, staff. We'll let you continue doing your very important mahi. Yes, thank you very much,
everyone.
All right.
Thank you.
Thank you.
All right, whānau, I will take us to, we were at page 10 in regards to the action items. There's an update that's already there. I will take it that we have read the update in regards to the actions. Are there any questions in regards to that? I think it's really quite straightforward. We're heading to about the transitioning over, and that the information will be collated at the board level and then handed over from there.
We
All right.
don't have any further guidance on that yet.
Okay, catch the play. Thank you very much, Kim. All right, I will take us to page 11, our shared services report. I'll take it as read. Do we have any questions in regards to it? I'll allow it, sir. All right, kia ora nā. Still on mute, Tunangi. Oh, tuakana.
Go to that screen. Come back to this screen. Oh, lordy. I just wanted to ask on page, on page 11, just at the bottom of the right-hand box there, that term, te ara tiake pakeke, is that the right word, tiake?
No, it should be an I, T-I-A-K-I, I think, isn't it?
Tiake, yeah, okay.
Yeah.
Oh, that makes it.
Yeah. Makes it sound, make sense. Yeah.
Yeah. But also just to add on top of that, running the proposed hearing aid clinics in April. Looking forward to. I'm pretty sure the whānau will be looking forward to those things happening at Te Roro and other places. So, ka pai.
Awesome. Thanks very much there, Kim.
Thank you. Not really specific to this particular report, but across all of the service reports, there's a reflection of recruitment challenges. And it seems to me it might be useful for the board to understand the scope of our vacancy issues across all of the services, and particularly what services are at risk of continuity.
Yeah, absolutely endorse that. Absolutely endorse that. Kim.
Yep. I can make some comments now. There is, it's variable across services. Nikki just mentioned before around our midwifery service. We are, got quite a shortage there of midwives, and so we've had to reconfigure the way in which our model of care in that service to be able to get through that period of time. So preserving our limited midwifery staff for the duties, top of scope duties that midwives are able to perform, and augmenting that with registered nurses and healthcare assistants to be able to maintain that service over the period of time. That's a common feature. Just a report at last week at the Chief Executives meeting around a series of actions that DHB is taking nationally around a lack of midwives. Some of our nursing roles as well, our ever-present numbers of senior medical staff, although we've just been able to recruit a few, possibly coming out the other end of the pandemic now, people starting to make some decisions about where they're going to go to. And then, of course, our mental health practitioners is another area. So definitely could provide a bit more in depth about that at the board.
Awesome. That would be great. Even if it came in kind of a tabulated form, right, of services, staff currently, staff needed, et cetera, things at risk. And he's just written something in here. Only now getting my head around scale of the employment calendar myself on a site and had 53 vacancy ads for Hauora Tairāwhiti. The vacancy employment issue is a thing nationwide, but it'll be a good idea, like the chair of our board has said, be a good idea for the board to fully understand that, and for that to be collated, not only for our understanding, but also for the transitioning as well. So we're able to give some really good data to Health NZ when the transition occurs.
And Fraser, do you want to just talk about the work that you're doing with leads around our recruitment drive that we've got on at present?
Yeah, kia ora whanau. I was, as it clearly became clear that a priority was recruitment as heading into the role in my first month. So I've engaged with each of the leads around putting together a consolidated marketing and communications approach to really put Hauora Tairāwhiti out there nationally, to really compete for the staff that are coming back into the country, but also to lure people out of the larger centres to come and really enjoy or really take advantage of what Tairāwhiti and Hauora Tairāwhiti has to offer. So I've put together a proposal which I've circulated to the leadership team, which includes, so we had a photographer here at the hospital on Thursday. So we visited over around 15 or 20 services. Each service put forward 2 champions. And so I'm expecting those photos. We got some fabulous photos. And so we'll be going out through our social media channels, Facebook, social media, probably starting this week, and through a paid campaign. And we're also engaging with a local agency, Woods, who is local guy, Reuben Woods, who's been in the Bay of Plenty for the last little while, but he's opened up a local branch. So what we'll be doing is going up with a national campaign over the next 3 or 4 months to really highlight our region and our way of working. And our way of working is what Nikki highlight as well, is what Nikki touched on, and that's that Manaaki way of working. And that really came through when I was talking to the champions on Thursday around, okay, what do you think that will entice people to come to Te Tairāwhiti to work and to Hauora Tairāwhiti to work? And they said, well, firstly, it's the work-life balance, and it's the way that we work here in Hauora Tairāwhiti. It's the relationships that we form, and it's really that the relationships with whānau and the community that you don't get in the larger centres. So I can provide a report at the next meeting of how that's going, how we're tracking, and happy to answer any questions on that too.
We might, we might take that with the paper at the board meeting, maybe. Like it'll be good to get the to have the information provided first to be able to digest that, so that our questions kind of have some form and substance when we're asking, we're having a conversation with you, Fraser. Unless there's anything burning that someone wanted to ask now, but I feel that would probably be the more appropriate form. All right, thanks very much for that kōrero there, Fraser. Appreciate that, Hiwa. Any other questions in regards to page 11, our shared services report? All right, I will take us to page 12, medical surgical services report. Take the page as read. Any questions or kōrero?
Put a real hand up.
Yes, start.
I just wanted to congratulate the team on their dogged perseverance around the bowel screening program and finally getting it to a place where we originally thought it should be. And now noting that it's gone, MOH are taking it nationally. I think that's great kudos for the team to continue that. I think it's 2 years in its evolution, Jim? Might be a bit more.
It is, and we are now posing the question to the ministry around the agreement that we had that once we got it up and away, that we could lower the access age for Māori. Now's the time.
Andy?
Yeah, thanks. Just the one that sticks out in the planned care targets, the minors target of 95%, but achieving actual of 68. There's quite a big gap there.
Yeah, I think that's just a data issue, Andy, but we'll get something on that as well.
Okay.
Do we have any other questions or kōrero in regards to medical surgical services report? All right, I'll move us to page 13, our Te Ara Mairoha Mental Health and Addiction Services report. Take the report as read. Any questions or kōrero? Is your hand still up from the previous, Andy?
Yeah, no, it's down, Josh.
Okay, couple.
Sorry, Josh, if I could ask a question to Jim. In his previous comment with immunisation during Nikki's paper, you mentioned, and we talked about the Tairāwhiti way of doing things, and you mentioned that the Ministry of Health was struggling with one particular aspect of mental health. Is this an appropriate time to share that or later?
Ariana, that was the thing that we talked about on Friday, maybe later.
Mm-hmm. Thank you.
Okay. If there are no further things to expand on in regards to Te Ara Mairoha, I'll move us to page 15, our Women, Children and Youth Services report. It's really great getting the presentation. I really did appreciate that. It humanised the data that we get, right? And humanised the kōrero that we get. It was really, really great. Very impressed by the little tidbit Nikki gave us in regards to recruiting strategy. Absolutely fantastic. Really, it was a really great presentation. Off the back of that, whānau, do we feel like we need to ask any other questions? Because I do feel like we kind of asked questions in the presentation that were linked to this paper. Andy?
Yeah, it does state that there's a reduction in the BAU. I just wondered whether, I'm sure that relates to staffing, but we're comfortable with those reductions in the BAU.
Yeah, well, I don't think, it's we wouldn't have reduced the BAU if we could have avoided it, but, to have that focus around particularly the vaccination campaign, COVID vaccination campaign, our public health nursing team we're at the forefront of that. It's good now that they're all returned back to their BAU duties, as the focus has shifted away from them in that campaign. So yeah, we've been able to move past that, but yeah, they've stepped up many times in the last 2 years.
Awesome. Thanks for that reply there, Jim. Had to reply there, Andy, or did you have a supplementary?
Yeah, sorry, I put myself on mute and then said thanks very much.
Awesome. Thanks there, Andy. Any other questions or kōrero? Ka pai. Well, I think that's it for our public agenda. Let me just double check. Oh no, sorry, there was a COVID-19 update. That's right, a verbal update. You want to, would you like to give that now there, Jim? Ariana, who's taking the lead on that?
Me. I'll just put it up for you. I've got a few slides for you. Hopefully everybody can see that.
Yep.
So here's what the situation looks like currently. One more day of data on that, which is yesterday's number, which was 383. So up a little bit. Again, the usual Monday effect of more people getting tested on a Monday, but the 1 day there probably won't make much of a difference in terms of that 7-day average line just trending down a little bit now, coming over the top and heading down. Quite a flat trajectory on top of our graph there, bearing in mind that that's a logarithmic scale on the left-hand side there. So it looks very flattened out, but you know what it looks like when you have it just on the straight numbers of cases going up as we did, and I'll show you what that looks like shortly. There's other lines on there. You've got the percentage of males, the percentage of Māori. Note the percentage of Māori is slightly dropping down as a proportion of the population, and that is a little bit because if you can see down the bottom there, the bottom line there of age over 50 years is drifting up a little bit as well. So that's having that corresponding reduction in the percentage of Māori. Still just slightly under 50% of the cases reported males, and around about the 20-odd% or slightly more than that, between 20 and 30% of people reporting unvaccinated. So that's either no doses or 1 dose of vaccine. So disproportionate numbers of people who are unvaccinated who are testing positive, as you would expect. The profile of, oops, does it come through? Why isn't that showing up? Yep. The profile of people who are coming through there, still again that skew towards the left-hand side there of young people. Probably the 0 to 4s is just a reporting matter because less likely to be reported or even tested in that age band. So definitely a skew to the left, which then explains the proportion of Māori that are reporting testing as positive, and still a very low numbers of people in the right-hand side there of our Pākeke. And this one here gives you that with just actual individual by ages. So same profile, but just not bulked up into those 5 age group bands. And just the same picture. They're showing the positivity of the cases that have been reported. Just a slight 65%, as we said before, of Māori reporting, and if anything is disproportionate on that, it would be the Pasifika, being slightly more than what you would expect for the population there. I've shown this one before, which is showing how the changes have occurred over the period of time of the current outbreak. So in that first 10 days or so of that period of time, quite a high proportion of Māori within that, within the whānau that were originally showing up cases at that time. and then the outbreak changed a bit and moved quite into a number of our Pasifika whānau at that point, and then gradually it's changed to what we've got now with that 60-odd% of Māori being in that group. From a suburb point of view, unsurprising when you see what the population demographic is, to then see where the suburban population is who have been mostly affected and reported on that. So our larger suburbs there, Kaiti and Te Hapara, with the most numbers of cases, and Elgin. And again, a feature there of not a lot of reported spread to the coast, but I think we know that there'll be underreporting of numbers of people on the coast who have tested positive, and or A, who haven't tested, B, who have tested positive and haven't reported their positive results. The modelling for us, you can see that on that modelling there that we're way above the modelling curve. I believe that is in part the fact that we're utilising rats, so we've got a much higher density of testing within the community than we would have done under the old under PCRs, and so you can see what happened once we started utilising rats. It just immediately hyped the number of cases that were being reported within the community. But you can see in that we have moved past the peak of that, notwithstanding that today's number will be up quite a considerable point on that graph, but somewhere around about up here somewhere, about there somewhere for today. So it's definitely a beat by beat reduction coming over the other side there, but I'm sure that will continue to drop away over the next few days. Of course, in comparison, a bit difficult to see, but you can you can see that whatever colour that is, blue, I think, line is pretty much tracking the national modelling. So from a national point of view, the cases are tracking the national modelling. The also on that is the fact that we've got that really steep rise on the left-hand side of that graph. Again, would have been affected by the start of rats, but then a comparatively slower drop away on that side. So what we're seeing around the world is not a symmetrical curve, not your symmetrical bell curve. It's protracted on the right-hand side, and while those ones go down to zero, we know it won't. That there'll be a residual number of cases occurring within the community for many months to come, if not, definitely many months to come. From a Tairāwhiti, return to Tairāwhiti again, numbers of people hospitalised. So we are very firmly on that low track for numbers of people hospitalised. And again, all credit to the vaccination program and public health measures that are being taken to try and prevent the spread to people, particularly vulnerable people within our community, and vulnerable people being protected. As we know, the vaccination rates for our total population and for our Pakeke are very, very high in Tairāwhiti, and we are well served by that in terms of the numbers of people who, for them, avoiding needing to be hospitalised, and from the health system, for those people needing to be hospitalised. Yesterday, for a very brief moment, we had 6 people in hospital with COVID, and so that would have been, that's about the peak of that graph there. But we were able to consistently enable people to get home again and be discharged from hospital. And then just lastly is yesterday's figures around vaccination. Our efforts at present around vaccination are now tailored at specific communities and settings that are more likely to encourage people to be out there. We have a big focus on 5 to 11-year-olds events, such as that at Waikirikiri Park on Sunday, which are proving successful. Over 200, nearly 250 people vaccinated in that event there, proving that that's the way to go in terms of being able to encourage whānau to come out together to get the 5 to 11-year-olds vaccinated, and also to make sure that the older people within the whānau have their boosters or their second doses if that might be required for those people. So we still have around about, to get to the 60% Māori double vaccinated, we've still got around about 600 people to go. But some of our other numbers, our rates for 5 to 11-year-olds for Māori are coming up well. We are one of the high rates in the country for both boosters for Māori and for 5 to 11-year-old vaccinations for Māori. So I will stop the share and see if there's any questions.
Thank you very much for that, Jim. Andy.
Yeah, it's just the last point you were making there, Jim. I had it as a question from yesterday. I heard over the country 50% of the 5 to 11s vaccinated, and I know it hasn't been around as long, but I just wondered whether that was a satisfactory progress. And I see we're at 48%. Is that a number you would expect, or would you like it to, well, we would all like it to be higher, but is the progress on that number going at a rate that, we're comfortable with them?
No, we'd like to see, we'd like to see much closer to 100% of our 5 to 11s in Tairāwhiti vaccinated.
As the expectations, do you think?
Sorry?
As the expectations.
I think there's a national target to get to 90%. So whether we'll get to that point or not. At present, a lot of whānau are dealing with the fact that their 5 to 11-year-olds are actually sick with the virus and off school. So that's the main focus of whānau at present.
Is that trending up, or is it sort of going down? I know with the other vaccinations, once you got nearer, it got harder. Once you got up there, it got harder and harder to really impact the numbers.
Definitely, it's children's events tend to be well serviced, and that's why we are having those events, which are children focused, both at like Waikiri Park, but also at school settings, after school settings, and into the evening, to be able to encourage families to come out as one, to be able to bring the kids along and have a good time and get vaccinated at the same time. So that's what we're doing currently. But
I think possibly
to be frank, the days of having hundreds and hundreds of people vaccinated in an event are gone. Yeah.
I think early on we were dealing with the misbelief that it was an older person's disease, and we're seeing from the numbers coming through now that it's absolutely not.
Yes, and I think that what we're hearing too, I mean, you all would have heard this, that some people have a very mild illness and very minor symptoms and effect on them, and others are quite ill, and it appears to be, while there is obviously a greater risk for our older and more vulnerable people, I've also definitely got examples of younger people who have had quite significant effect. And then there is the question around long COVID, which we know we were getting stats from some countries, 1 in 10 people being affected by long COVID.
Thanks, Jim. Keep up the good work.
But just whilst there's any other questions, just to emphasise, we've still got out there with a rapid antigen testing distribution centres and basically making sure they're everywhere we possibly can. We have got currently around about 250,000, no more than that, probably well over 250,000 RAT tests available just in our stores, and that's not taking into account the deliveries that iwi are getting at 100,000 RAT tests at a time. So there is absolutely no shortage of RAT tests anywhere, and so we're just making a request. If anybody needs some RAT tests, just let us know, because we want to get them out of the. No point in them sitting in the in our store. We need to get them out. Yep.
Any other question? Oh, sorry, Jim. You were
I was going to say, from a hospital readiness point of view, we are, from a staffing and reconfiguration of the hospital point of view, we've got this week, as you would have seen, we have reduced the amount of planned care services that are happening, which has enabled us to free up some staff to help those areas that have got more staff that are off sick or self-isolating at present. So that's worked out well in terms of timely for that. In fact, actually, we've got less people this week off sick than we did last week, so that's a good trend. We have also got some people helping out from the vaccination program as that has scaled back. At present, we've got some people that can help from that. And also we have made a decision to employ 30 extra people, healthcare assistants and general support people now, so that we're ready for this part of the pandemic and also into winter. And as we know, we've got gaps in staffing areas, and while these people cannot take the place of a midwife or a registered nurse or a doctor or an allied health professional, or indeed other people in trained roles like stores workers and people like that, they are proving to be a really good resource to enable, as I said before, those people to practice that type of scope. And we also see that as a developmental opportunity for our community to bring these people in and support them for future career intentions that they may have. They're generally younger people, and some of them having a new start in terms of a career. So we're looking forward to working with those people as well. So it's having a dual benefit for that. Takatū is still out there working to try and provide support as much as possible. Completely, the thrust there is actually now with iwi and iwi work that they're doing, but still working alongside and supporting that work as well. And SIQ, we've got just being able to negotiate with MB another 8, and these are 4 to 6 worth camper vans that arrived on Friday and have been distributed out to iwi for them to be able to utilise in supporting people and boost our amount of SIQ availability at this stage.
Awesome, thanks very much there, Jim. Kim, you have a question.
Yeah, Jim was just starting to touch on it with Takatū, and I was just wondering, Jim, if you could talk a little bit about the capacity of both Takatū and the primary care sector to be able to be providing clinical oversight, and particularly into our areas that have got much higher infection rates, like up the coast.
Yeah, so that is very much dependent on the ability and the capacity within local services. So the team at Takatū are able to, the team at Takatū are supported. We've got a team of general practitioners that work within there that can provide support. They are generally doing that through the other, they're sort of like the sector experts and are providing that support other primary care providers to be able to do that. So the main thrust is around online and by phone support for people within the community, and helping particularly Ngāti Porou Hauora, as they are shorter on people on the ground to be able to provide that support. So that's where they're working in, and that's where the capacity is within primary care to support colleagues to be able to do that. Ariana, did you have any thing further to say about that?
Yeah, no, that's fine, Jim. That's literally what I was going to say.
Awesome. Doesn't look like that there are any other questions or kōrero. Thank you very much for that update there, Jim. I really appreciate that. This moves us into our the public excluded part of our agenda. So I want to thank the masses of people that tuned into this live stream, and we'll just wait a